Hello everyone, and welcome back to my channel. And today I'm just going to be showing, if you have seen my last video, because I've got gangrene in my leg, and it just had the pad on, you know, to hold on, because I've had two operations on my leg. One when I first got sepsis. What happened was I got this what do they call it again? Abscess, and it got infected, and then I was taken into hospital because I was hallucinating. Because what happened is the abscess had gone septic, so I had septicemia, which had gone through all my bloodstream, and then when it hit my brain, it made me hallucinate. So they done an emergency operation on me. They took me in. It's about 10 past 12 at night, and they operated on me at 4 in the morning. And I could only do an anaesthetic on it, local. I only got a local injection, so they can't put me out, because obviously they think they'll kill me if they did. So they've done a local, and I could feel everything. You know, I felt him cutting into it, and then I felt him hacking inside and everything into my leg. It was horrible. Anyway, the sepsis, then they took me back in, because I had nurses coming in every day. And then for about 4 days I was out, and the nurse came in. She said, "I'm not happy with that, because it was all swollen. It went like a black and blue on the skin outside, and it went right down to my knee, so, and up into my hip." So when they took me back in hospital, this was about 12 o'clock in the afternoon. By 4 o'clock they were operating, and they'd done a second operation. This was a week after, and they'd found that it turned gangrenous, so I got gangrene in my leg. And now all of the antibiotics they give me the strongest antibiotics. There was no more antibiotics they could give me, and penicillin, so you know, none of it worked, and on the sepsis, and it turned into gangrene. So now everything has to be, they've operated on it again, and they've cut out as much of the gangrene as they could. And what happened then was I got a pump fitted on the Thursday. It should have been fitted on Thursday, but I got it fitted on the Friday. And then on the Monday, I was getting released out of hospital, and the nurse is coming in. And then what happened then is on the Monday they fitted the pump. They fitted on the Friday, and on the Monday it got changed, and it never worked properly for 4 days till the Thursday. So I came out on a Monday, and then on a Thursday they came out, and the pump wasn't working properly, so they took the pump away again and just put the pad on. That's when I made the video, the last one. And what happened again on the Friday, they came out and they put the pump back on. So I'm going to show everybody what the pump is. As you remember, there's 3 ways it can go. One way, they're trying to keep it where they are, and they're trying to keep the gangrene in the local area and hopefully get rid of it there. If it fails, then there's 2 ways it can go. One way, it can travel down my leg, so the most it can happen is I can lose my leg. The other way, it can travel up my hip and into my stomach and that, and all the groin, and it can make a mess there and kill me. So that's what they're trying to fight against. They're trying to stop it from going down my leg or going up into my hip. And so far, things, I'm not sure what they're going like. Anyway, I'll just show you quickly around the room. Look, it is an absolute tip. My granddaughter, look at all this lot. My granddaughter, look, she's made it into a tip. She's chucked the toys all over the place. She's drawing, she's doing everything. She's just gone wild with it all. There's one of her dresses, I think, her top. She just chucks everything on the top, and there's a laptop just chucked on the chair. She is wild. Over this side is my stuff. I have my 3D printer, which I'm repairing. As you can see down there, the main board went on it, so I got a new main board. And then that box down there under the towel there, that's the wife's air dried what it is, she can make pottery. She's going into pottery anyway. And this one here is my battery. I'm doing an experiment. Normally I do it in the shed, but I'm not feeling too good, and they want me to keep off my leg. I'm not gonna do that. So, because I'll show you what happens in a minute. And then up there is a solar panel. I'm trying this new solar panel out. Now that's supposed to be 200 watts. It's supposed to be able to produce 200 watts at a maximum 18 volts and give me three amps coming through. So I'm not sure if it's working. Well, it is working. I'm only charging them little batteries up there, and it's working a dream. It is literally pulling something like, I've never seen it go below 16 volts for charging up, but it has charged the battery up in amazing speed. I'm not sure that is a brilliant solar panel, to be honest, and the size of it. You know, I was gobsmacked when they're saying that's 200 watts, and so far I've tested it. It's never went up to 200 watts, but I have had 150 and 140 out of it. 150 was what the best I've got, and 140 is about average between 120 and 140. But as you can see, it's getting the sunlight, but not as much as it can do if I put it in a decent place. So it may just push the 200 watts, but fantastic, and it's going on there. Anyway, I was thinking about, should I show you the pump first, because I'll show you how all this works, the pump, and how it's fitted into my leg. What they've done, I'm going to just sit back here, and I'm going to take it out like that. It's up the top of my leg, as you can see, and that there, I hope you can see that, that's where the pump is fitted into my leg. That goes into the wound that the surgeon made. It was quite big, the wound, and they don't want it to heal. They just want that in there to just keep sucking out all of the gooey stuff. And there's the pipe going down, and it goes down to the pump on the floor there. I put it on the floor because it doesn't matter where I put it. I can put it high or anything, because it still just keeps pumping out. But as you can see there's the pump fitted onto the wound. It is going down here, a funny colour, and I'm not going to show you any further. It goes into my groin, which is a bit more not the same colour as my skin. It's more like going into a purpley colour, and that's where. And what he done when the surgeon done it, he cut there, obviously cut across there, and then put the clamps in and opened it up, and he started hacking all the black stuff, he said, and green stuff that was in there, and that was, I think that's why they call it gangrene. But what happened is it swelled right up there, right up to my knee here, and I had a great big lump. It came right along there, and then when he operated, he said what he does is that the clamping, then they stretch it open, and they got into there and all the way down there, and he said I've cleaned all the gangrene out of there. Then what happened on this side here, it's still a bit hard there, it's rock hard there still, as you can see, and that goes, I'll just run my finger there, that goes to the end there now, which I'm glad, because it did go right up into my hip, that lump, but it stopped there. So he's got most of it out of there, well, all of it. He reckons he's cut all of it out, but to be sure, this is going to stay on. He said it's a long time, and I said how long? He said it could be 3 months, it could be 6 months, it could be a year when the job's done. He said I'm fighting to save your life here, he said, and your leg. So hopefully they'll keep it in this area. This is the area they've got to keep at the top of my leg. But the abscess there, when it was there, God, it went up as big as a tennis ball. I don't know if you can see there, but there's my finger going above it. It went about that high. It was huge, and all right up to my hip. It swelled right up, and all right up to my knee down here. It swelled up, and all the swelling's gone down. I have a hard lump there. It's rock hard there. Then it goes a little bit soft. Then up to the wound, it's rock hard again. That's where all the gangrene was. So they cut it out. So hopefully I'll still have this leg, but if I lose it, I'll show you the end result. I can't show you if it goes up over, because if it goes, from the wound, and just where's the wound? There. And if it goes from here and it goes up over like this to where it was in my hip, it will travel into my body, and there's no way they can stop it. except just keep hacking at it and keep it out. But if it goes into my organs inside, that's it, I'm dead. So I can't show you that one because obviously I'm going to be dead. Hopefully this is the area. They're trying to contain it in this area, the areas I've showed you, which is around there and up to here. This is where it is now. This is where the gangrene is now, around this area. You can't see it, it's under the skin. It's eating away at my flesh inside my muscle and that. They said they don't want, they said I can get up and go to the bathroom and stuff like that, but they don't want me walking outside or anything like that on my leg. They don't want too much putting on it. They would just want the pump to do its job. So anyway, the pump goes down to this and it comes up to here. This is where it joins, the pipe joins. Now I'm allowed to take it off. I'm allowed to take the pump off and then cap it with these two things here. Yeah, I can cap this side to stop the blood and the guns coming out, and I can cap this side to stop the, turn the pump off, and you just cap the side so if there's anything in the pipe it won't come out. Then they've got give me plenty of pipe so I can sleep in my bed and put it down. Now here's the pump that's fitted onto my leg. I don't know if you can hear that. That's a little click. You can see some of the goo inside of it. It's steaming up a little bit, but the goo goes in and you can see it there on the back there. That's on the back of it, and that's all the gooey stuff out of my leg, which is in. And the pump, I'll just put it on, I'll turn it on. Now I'm not supposed to be able to do it, and as you can see there, it's on 5 minutes, and that's at 60 mmHgs. They've had to put it at 60. They can't, because I'm a very high risk of bleeding out if they do. It's not, these machines apparently are normally set at 80 mmHg, but they've put it down to 60 for me to stop me. If it starts to bleed, I have to go straight back in hospital. If my skin coloration, which is a little bit, if it gets any worse than that, I have to go back into hospital and have another operation. The last operation, they used epidural on me, which was brilliant. I mean, the first one with a local anaesthetic, it was murder. I could stand it, like, I was like, and because he'd give me some drugs, he said, I'm not sure whether you'll feel it or not. And my God, I felt it, the operation. But like I say, it's not the first operation I've had where I wasn't put out and I could feel everything. The epidural done a good job, because the second operation was a bigger one. He had to make the wound much bigger and much deeper. I mean, he almost went down to my bone, my femur bone, and cut it out. So on that there, you see 5 minutes on the top. That's the clock countdown. It's set for 5 minutes pumping, 2 minutes rest. So it stops pumping for 2 minutes, then back to pumping for 5 minutes. And like I say, I've been through all the settings on it. There's all the settings there. I've been through all the settings. I put the volume on high so I can hear it, because I'm deaf in one ear. So, and I went through, and when it comes to this one here, time zone, flow meter, all that lot. Hang on, I'll just put it back on there, and I can change the mode and all that. And then it comes to this one here. Hang on, where is it? Time zone, it's language, change mode, which is, it says patient restricted. Yeah, I hope you can see that. Again, I'll put it a bit down. It says patient restricted. When you put it on, you have to put a passcode in. Well, I've cracked the passcode, and I've been through the whole machine. So yeah, that's what's happening with this pump. Apparently, these machines are very expensive. Because I can pause it and all that, but they don't recommend pausing it, and it registers. It also registers how much is going in. It'll come up in a second, and it has the dates. There it is. It has a date, and that's how much it's pumped out. 1 second, I'll get down the corner. There you are, and then it's got the date there and everything, and how much it's pumped out of my leg and stuff like that. So them 2 full days have been the most. Today is what you've seen in there, which is roughly that, but by this evening it's probably going to be full. So yeah, that's everything on that. But that's what I'm going through at present. The strap, I'll show you the strap. Now the strap on this, it didn't come with the strap. They wouldn't give me a strap. I heard that it goes in like a a pouch thing, like a bag thing that hangs over your shoulder, and they wouldn't give me one because they don't want me walking on the leg and weight bearing too much on it. So I've made the strap myself, look. Ingenuity, isn't it? You know, improvise. And I fitted it on the sides where the straps should go, and I've done a bloody good job. I think I have, and I've done it nice and long. It's twisted a bit, but that's just because it went over. You know, when I use the bathroom, I stand it on the radiator because the pipe's long enough for me to get to the toilet or whatever, and I can actually use go to the toilet and that. So the strap makes a great way, so I don't have to carry it. I just sling it over my shoulder. The pipe's a bit long, but I use these clips here, these ones here, and I use them clips there, and I tie them to my t-shirt. Well, I clip them onto my t-shirt. Works just great because it, you know, clip onto my t-shirt, that keeps the pipe off the floor and stops me from treading on it. So yes, that's all the what's on now. I'll keep you updated if you want, if people are interested. Keep you updated. But I'll tell you what, please, everyone. Now I got the vaccine for COVID, the first vaccine. 3 weeks after, I ended up with this great big abscess. Now I don't know if that's anything related, but like I said, it doesn't matter. I have a lot of underlying things that's happening to me, and don't anybody take what's happening to me as you know, a thing that you do. Everyone, get your vaccine. We need to get rid of this stupid, well, it's not stupid, this dangerous, very dangerous, because it's actually hitting kids now with the new variants, and we need to get rid of this pandemic and get it out of our lives so everyone can turn back to normal. So please, everyone, get your vaccine. Do that. It's not bad. There's only a couple of cases that they're saying, and you know, you're not that person. If you're young or if you're fit and you're healthy, even if you're old, you're 70-year-old and you feel fit and healthy, don't worry. The vaccine is totally safe. I'm telling you, it is totally safe. There is only a couple of cases they've said, but they're not sure whether they're like this, like the gangrene and stuff like that. It states, when I've read up on it, it states it could be the COVID that's causing it, but I'm not even interested in checking up on it. These things happen. I already have heart failure, which yesterday I had a bad doubt. My blood pressure went through the floor. I think the wife said it was 47 over 68. My heart rate had dropped right down to 29, I think she said. But that's me. I have heart failure. I'm not sure because that's what's supposed to happen. Some people have said that gets the injection, so I had my second dose, and the only thing I've experienced is just a little bit of an ache in my arm and my shoulder, which was nothing. So I will see how it go. So anyway, everyone, I'm going to say thank you for watching my videos. Please, can you subscribe? I need some more subscribers. Can you watch and follow them, please? Everyone, press that bell so that you can hear more. And I'm going to keep you updated on this one so that you can see whether either I've lost my leg or I've lost my life, or it's been very successful. I'm keeping my leg and I'm keeping my life. So it's a bit of a scenario, but well worth watching. I would watch for it if someone said it. So everyone, I really do thank all and appreciate all of your feedback, for everyone that's leaving feedback on the last video regarding this. And another one, I've just labelled it what keeps me alive, because I'm on a ton of medication and I've been for a while. Anyway, so like I said, I really do appreciate everyone. Press that bell, please. Please subscribe. I need subscribers. And I hope, you know, there's videos that people don't like. I understand. If you want to slag them off, crack on. I'm not bothered. Everybody has a right to go on YouTube and show their stuff, and there's lots of good stuff on YouTube. There really is, and I really do welcome all them people that come to my site, because as soon as they come to my site and as soon as they, you know, when they hit all them buttons and all that, I'm interested in their videos, and I'll look at their videos, and I'll tell you one thing, I haven't got one bad subscriber. Everything is totally interesting. I love the lot. So I start watching their videos. I don't have time to watch any other videos except all the people that view my videos. Because when you view them, I pay respect, you know, I view back. So anyway, anyone that's missed out on any feedback from me, you know, if you, I do apologise. I do try. My assistant, my wife, that is, she's trying her hardest to do all the answer all the comments and stuff like that. But I will try and get round to you. But please, you know, as you can see, I'm not in good health. I do try my best. I do try to keep the videos coming. I struggle sometimes. But I'll be back out in my shed. I went out in my shed to do a project, and to show people what I'm doing. But I took ill. Ended up, you know, kissing the floor. Bust my nose, bust my lip. Because I just collapsed, like I told you, my blood pressure dropped to the floor. So did I. So anyway, I'm going to love yous, and I'm going to leave yous, and I'm going to say good health to everyone, and everybody has lovely days ahead of them, and happiness and good health. Goodbye.